This is Louise Miller, Town Administrator. I am here with Julia Young-Hans, Health Director, and Ruth Morey, Public Health Nurse. We wanted to give you a quick update on COVID-19, social distancing, what it means, how to do it. We wanted to reiterate the importance of social distancing, especially now we are in the 5th week of the pandemic. We will be starting the 6th week, and there is still uncertainty about how long or what we will have to do in order to move forward. We understand that the stay-at-home and social distancing are putting a strain on many of us, but we would like to re-emphasize why it is so important that we continue practicing social distancing in the weeks to come. Limiting face-to-face contact with others is the best way to slow the spread of COVID-19. The governor has publicized some graphs. And you can see here one of the graphs that has been publicized. One of the reasons why we need to practice social distancing and limit face-to-face contact is to flatten the curve. Flattening the curve really means not necessarily reducing the total number of COVID-19 infections, but rather bringing down the peak. The length of time during which we will be experiencing this pandemic may be longer, but by bringing down the curve, by flattening the curve, we will be relieving stress on the healthcare system and on healthcare workers. COVID-19 overburdens our ability to provide effective medical care, so flattening the curve is essential so that we are able to provide the best medical care for all the people who need it. How is Massachusetts flattening the curve? The governor has issued a stay-at-home advisory, which means that everyone is advised to stay at home as much as possible. The governor has also issued an order for mandatory closure of non-essential businesses. There is a long list of what an essential business is, but this, together with the stay-at-home advisory, ensures that as few people as possible are out at work, out on the road, and interacting with others. And finally, social distancing. And social distancing is something that every one of us do, whether we are essential or non-essential, and participating in essential businesses or non-essential activities.
Hi everyone, this is Ruth Morey, Public Health Nurse here in Wayland. I want to make sure that we discuss the governor's stay-at-home advisory. In regards to this, we do need to make sure that we limit our interactions only to people who live within our own household. We should not be gathering with family and friends who live elsewhere during this time. One way to make sure that we are staying in touch with others is we certainly can enjoy an online or telephone social interaction when we want to be in contact with those who do not live within our household. So what is it that I can do during the stay-at-home advisory? It is important to note that right now we have community spread of disease. It's very infectious and extremely important to be strict with staying at home and limiting interaction to those only inside our household. We need to limit social interactions to those who live within your household. We do not gather with family and friends. And as we previously discussed, we can enjoy talking and seeing each other through the different platforms that are out there. However, if I do need to go to a store, I would make sure that I stay at least 6 feet away from others, and per the recommendation of the health department, I would wear a face mask or have some sort of face covering as well as gloves. When I'm at the store, I'm going to avoid areas where there's a large group of people and move away from the group until that area has thinned out, and then I would participate in what I was going to get. If I'm going to take a bike ride or a walk, I'm going to avoid interaction with people if they are closer than 6 feet. I want to make sure that I always stay at least 6 feet away from individuals, even on a bike, a walk, or if for any reason I'm out and I see another car of friends and I might be in a particular location or a parking lot wanting to get together with others. I also need to remember that it's important that I wash my hands often. If water or hand washing is not directly available, but I have access to hand sanitizer, then that is something that I would also use. I also would make sure if I was feeling sick for any reason that I would also wear a mask in my home if I was less than 6 feet away from my family members.
Do you have any guidelines, Ruth, on participation, what types of activities or what types of participatory activities people are able to do during this stay-at-home advisory?
When outdoors, this is Julia, I'm just going to chime in for a second. Some of the things that we want to mention is that people should be participating in solitary activities or activities with household members only, and not inviting a friend or a person who's not within your household to participate. Also, as a reminder, essential needs are the only things you should be really going to the store for, which would include food and medicine. And we have a safe food handling guideline, which is on our website. Also, pharmacy hours and delivery information can also be found on our website.
And this is Ruth. So what if I'm concerned about a neighbor or relative? It's important that we remember to check on our neighbors and our friends if we have concerns about them, and just to say hello. Our elders and others who are at high risk for COVID-19, we want to make sure that we are checking in with them by phone, or we can check in with them with email or video call, but we do not want to have direct physical contact with them to increase their risk of obtaining COVID. We can also set up an appointment to drive by or walk, talk to an individual from a window or door, as long as we're staying 6 feet apart. I know that I have been hearing that there's a number of people who are communicating with others through windows, and as people are walking by and someone opens their door, and that's also a nice way to say hello and to talk to others. It is important to establish a network with neighbors and friends to check on each other. And we have really continued to encourage the use of email, phone, and video platforms that work for you and your family. We also have helplines, and that's listed on the last page of this presentation that we will show you, in regards to if you need something and you do not have it available and you need assistance, by all means, please do not venture out, and please give our offices a call so that we may be of assistance.
This is Julia Young-Hans, and so I'm going to talk a little bit about the mandatory closure of non-essential businesses. Currently, we have orders from Governor Baker's office regarding these non-essential businesses that are identified, and these are listed on the state website, which is also, there's a link included on this presentation. So the message is that this is not a vacation where people should be thinking they're just going to go out and have a good time, although we do understand it's going to become increasingly more difficult to continue socially distancing during this time. It's very important to do so and keep track of what your kids are doing and where they're going during the day, because they could potentially come into contact with someone who might be sick and may not have any symptoms. And that's why we're talking again about why we practice social distancing. And the reason why is because social distancing helps limit contact with infected people and contaminated surfaces. COVID-19 spreads to people who are in close contact with each other, and currently where we're in what's called community spread of disease. There's a lot of disease around in Metro West, although we may not see it or be aware of it. The disease can be in the air if someone coughs or sneezes, and you may not know that that's happened before you maybe walked into an area or approached someone. So that's why we suggest that people should be wearing a face covering to protect yourself. Also, asymptomatic people who seem to be healthy can spread the disease, and they may not know that they're doing that. So people should stick to their family members who live with them in the same household. That's why, we're being so stringent about that, and that's why Governor Baker talks about that every day, as well as many other people on television and on the radio continue to talk about it. They're still learning so much about this disease and how it spreads. Someone could carry the disease and have no idea that they're carrying it and give it to someone who can bring it home to their family, and someone who is in a high-risk group could get really sick from the disease. Also, COVID-19 can be spread if a person touches an object or surface that may have the virus on it, and then could touch their own nose, mouth, or eyes, and that's why it's so important to continue to wash your hands, use hand sanitizer, wear gloves if you are able to, and remove them very carefully. So, they are still looking into how long this virus can remain on different surfaces, and that's why it's so important to listen to these guidelines and advice. Once again, social distancing, staying at least 6 feet away from other people as much as possible. Especially if you have to go into a store, you should avoid any areas where there might be people waiting in a line or people gathering. Try to go when there's fewer people at the store. There are special hours for senior citizens and people that might be more at risk. Try to really limit non-essential activity in the retail stores. I mean, people still need to go to the store for items, but try to limit how often you do so. And we really recommend that people do not gather in groups. Once again, getting back to the idea that we don't really know who may or may not have been exposed to the disease. And we recommend that people cover their face when you're outside your house. This was strongly recommended by the Wayland Board of Health. And you could wear a bandana, a scarf. If you have a surgical mask, you could wear that.
So this is Louise Miller. So with respect to surgical masks, the town has been fortunate to receive a few donations of surgical masks, and we are making them available. They are individually wrapped, and they are available if anyone needs one by calling our general helpline, and we will give you all of those numbers at the end of this presentation. So what can you do to help the spread of COVID-19? Right now, as a town, we need to all work together, the best thing that anyone can do and that all of us can do collectively is to follow the stay-at-home advisory and practice social distancing. For parents, please remind your children that they may not gather in groups. We are finding that preteens and teens are continuing to gather and to basically hang out. It is extremely difficult to not be social. That is what everyone wants to do. Everyone wants to be social and hang out with their friends. But remember that every time someone interacts with someone in another household, they've now potentially exposed that entire household. And so if you think about it as, circles of people who are interacting with each other, the rate at which people could potentially be exposed is exponential, which is what the rate of spread of the COVID virus is. I want to remind everyone that playgrounds, fields, and beaches are closed. And the reason that they are closed is because they invite social interaction rather than social distancing. And all group activities are not allowed. There were various guidelines issued about what the numbers should be for group activities. There are no group activities allowed, and please practice social distancing. We're asking that everyone maintain heightened cleaning protocols, wash your hands often, disinfect surfaces, try to reduce as much as possible potential exposure. Be considerate of yourself and others. As Ruth, Julia, and I talked about this presentation, and we've talked with others as well, a good way to think about social distancing is to assume that both you and the person with whom you're interacting have COVID-19. So you need to protect the person from interactions with you, and you need to protect yourself from interactions with the other person. Now, this is very difficult and completely contrary to what many of us want to do. What we want to do is help others, and just remember, for every person that you help, assume that you are a COVID-19 carrier. So practice all of the guidelines, all of the items that we have in our guidelines. If you're delivering items, running errands for a neighbor, please remember to clean the items. Make sure that you have no direct person-to-person contact, and those guidelines are available on our website. Stay home, again, limit outings and interactions with others to essential needs only. And the last thing we would ask is that you self-report. Please call the health department and your primary care physician if you have symptoms. And I will ask Julia and Ruth to explain why that is so important for them to know if you are experiencing symptoms.
So all these cases are tracked on a database by the state, and we are notified through that process. However, if a person does not get tested, we would not know about their particular case. And the state is really trying to ramp up keeping track of this disease and knowing who has it so that we can, Ruth and her team, who've been working really hard on tracking down any individuals who've been in contact with a person that's been tested and confirmed as positive for COVID-19. And so it helps us get an idea of what's happening in the community and discuss with people the protocols and important measures for quarantine and isolation for anybody who meets those criteria as a close contact to someone who's tested positive. Ruth, you want to add a little bit to that?
Yeah. So this is Ruth. So I also would just add that we are finding that there are individuals within our community and every community that are, when they're symptomatic, they're calling their physician, and their physicians may state that, you have all the symptoms, of COVID, I'm not going to send you for testing, but please, follow isolation and quarantine guidelines, and they're often reviewed by the primary care physician. The reason why we would like you to contact us is, number one, so that we can assist in looking at your potential contacts and helping to determine and advise those individuals in terms of quarantine, because if your physician is clinically diagnosing you as COVID, then we in the town are considering that you are a positive result, even though we do not have the lab confirmation on that. But we also want to make sure that we're touching base with you so that if you're having any difficulties or concerns or questions, that we can take some of the burden off of your physician's office by assisting you clinically regarding guidance, because regardless if you are lab confirmed or clinically confirmed, we are working on symptom management, and that does not change whether you're lab confirmed or not. So by notifying our office is really helpful to us, and it just kind of also provides us a gauge in terms of where we're at with community transmission.
So I'd like to stress that self-reporting is not a negative. It's actually a positive for you, for the town, and for all your neighbors. And finally, Ruth and all of her staff are all registered nurses.
Correct.
So they're able to provide you with the care and answer your questions.
Yes, we're very lucky to have.
We are
the
very
community health
lucky.
nurses are a wonderful group, as well as Ruth's been doing a fantastic job, so we appreciate having that on our team.
All of our community health nurses are our school nurses. We have a different job title for them as they're under the health department. However, many of you know these individuals and are used to talking and connecting with them. And so all of our team has really, been greatly involved with all of our cases to help support. And if anybody has additional questions or concerns, it's always important to provide us their, to give our office a call. And I think that we'll be discussing those numbers next.
And you maintain privacy of all the information that you receive.
Absolutely. All information that we conduct through our health department, and always regarding communicable disease, is always maintained with confidentiality. We do not share specific identifying information. So for example, when you look online, we will be updating on a regular basis our case counts and whatnot. That's general information for our community, but there's no specific individual information attached, and we consider that highly preserved and remains confidential at all times.
So our last slide is, what if I need help? Whom should you contact? And we have a number of different phone lines and helplines that we have made available. The Health Department Coronavirus Hotline is 508-358-6805. That's for those experiencing symptoms or concerns about exposure and seeking information specific to the COVID-19 virus. The town's general helpline is 508-358-7701 for residents who may need assistance obtaining basic and important life necessities such as food or medications. The Council on Aging's phone line at 508-358-2990 for those needing Council on Aging services or to be added to the Council on Aging's list for a friendly check-in. Youth and Family Services Helpline at 508-358-4293 for those needing help with emotional support or mental health services. And this is not limited to anyone in particular. This is not just for those families that Youth and Family Services was servicing prior, We have expanded their hours and their ability to handle calls and refer anyone who needs help. If you do need immediate mental health services, there is a psychiatric emergency service in Framingham at 800-640-5432. We also have a complete list of contact and emergency helplines at www.whalen.ma.us. So I want to thank you all, and if you have any questions, as always, feel free to contact us.